Now, phobic disorders can be defined as a kind of, or they can be categorized as a kind of anxiety disorders in which the person has extreme fear, which is persistent in a lot of cases towards particular objects, or it can be even to particular situations. So, whenever the person is exposed to these kind of objects, or even if he's repeatedly exposed to these objects or these situations, he still has that anxiety disorder. He develops that panic attack, and that is why it has to be treated, because the functionality of the person is going to be affected in that way. His daily life, even his educational progress or his employment is sometimes affected due to these panic disorders. So they have to be treated in quite a managerial level, and you have to treat them after the assessment, after a complete assessment has been done in that particular patient. First of all, you categorize them upon their severity, whether it's of the milder symptoms, of the moderate or the severe symptoms, and then you start off with the treatment or with the management. So when we talk about these fears, they can be related to some sort of animals or some sort of situations. For example, agoraphobia. As we define agoraphobia, it's a kind of a syndrome in which the person feels uneasy when he is in the public places. So sometimes the people will give you complaints regarding the fact that they feel uneasy while they're eating in public, or while they are speaking in public. So it's a kind of social phobia that they develop. Now, when you get a complete history from these patients, you would also get to know that there are some other phobias that coexist with that major phobia that they'll come up to you with. Sometimes they complain they have these phobias to that particular insect, for example, spiders or the creepy crawlies. All of these, the person can develop phobias to these creepy insects. So we have to treat these patients as a whole, and if there is any comorbidity that exists in these patients, we have to treat that comorbidity as well. It can be hypertension, or the patients can be diabetic. Whatever it is, we have to treat that comorbidity as well. The results when you treat the comorbidity along with the major psychiatric illness is very good. So the phobic disorders, we'll be discussing the types of phobias that exist that I've already mentioned. There can be a lot of variants of these phobias that are available. It can range from claustrophobias, that is the phobias to the closed spaces. Then we can have the agoraphobias, in which the person has phobia to the open spaces, and all of these then the phobias of height and water. All of these basically exist sometimes individually, and sometimes there are multiple phobias in that particular patient that we are treating. Now, the prevalence is sometimes quite underrated, because we have to draw a line between the normal fears that a person can have from the phobias. So we have to basically draw a line whether it is a normal fear or whether it is a pathological phobia that needs a medical intervention, that needs a psychiatric treatment. Even sometimes counseling works very well in these patients. So we have to basically determine whether it is pathological, and if it is pathological, what kind of management lines we have to get on to treat that particular patient. And it depends, it varies from person to person, from patient to patient, what kind of treatment can be successful in that particular case. So the risk factors, there again, obviously, when we are considering the psychiatric illnesses, the environments can be one of the causative factors over here. They can be the etiology in that particular case, the particular environment that the person has been exposed to throughout his life, and even his childhood is again very important. So the history taking will reveal a lot of risk factors. So we'll be considering the multiple risk factors that we have to focus on while we are taking the history in that particular patient. Then we'll move on to the genetics. Genetics are again a very important risk factor that we'll be discussing over here in this section. So, the types of phobias that usually occur, we classify them in the three different types. They can be the social phobias, they can be the agorophobias, or they can then be the phobias to that particular object, for example, the insect. So, depending upon the nature of the feared situation. It's again very important that we focus on the fact what situation makes that patient panicked. So that panicky state has to be achieved in that particular patient. And what is the triggering factor? Sometimes the patient will give you a history about that triggering factor, and he knows what that triggering factor is. And sometimes he would be quite blank. He would say that I'm in a normal situation and I don't know what triggers that panic attack, in which I have sweats and I suffer from an increased heart rate and I start trembling. So all of this flight and fight situation arises out of nowhere. So when we consider an example of such a kind in which the patient doesn't know what is the triggering factor, we have to get the complete history, and that will clue out what is the triggering factor in that particular patient. Now, the types are the agoraphobias, as we have already discussed. They are basically the phobias that the person has towards the open spaces in which he is in the situations in which he is in public. So usually in restaurants or in parties, when they're socially interacting, the patient will have that particular panic attack and he's going to complain about that agoraphobia. Then the social phobia, when the patient is interacting or he's publicly speaking, he cannot have that social normal behavior that a normal person should have or can have, and he'll give you a history to that. Specific phobias towards specific objects. It can be towards the creepy crawlies, the insects, the crawling insects, and it can be towards height, towards water. So it depends upon, there's a huge variety to these specific phobias that vary from patient to patient that we are treating in that particular case. The agoraphobias, when we discuss about them, they're caused by being in the busy situations. So usually the person will give you a complaint that he is in the public space when he develops that panic attack, and there's no escape to safe area. So again, one of the criteria of that space that he's usually in, that he cannot go quickly to a safe area, to a private area. And then the social phobias, the fear of scrutiny by others. So sometimes the patient has that paranoid behavior in which he thinks that everybody is looking at him and they are trying to scrutinize him in every way. So that is when he feels that extreme or that persistent fear, and then the panic attack starts in that particular person. Now, being the focus of attention when everybody is looking at you, for example, you're publicly speaking and you have that adrenaline rush, you feel that heart rate getting a rise in its rhythm, and then you start sweating and there are tremors. So that is basically a kind of a social phobia. Small social settings are feared in these situations as well. Talking about the specific phobias, there are many and there is a lot of variety to this. Any specific cause of fear of animals, and it can again be the fear to the height, fear of water, fear of enclosed spaces, which is also termed as claustrophobia in these situations, and then fear to the dental treatments or any other medical treatments as well. Then the fear of blood, the fear of injury, and the fear of infection. So all of these are the specific phobias that we usually encounter in these patients that are suffering from phobias. So the prevalence of these phobias is sometimes quite underrated. Sometimes the people will tell you that they have that panic attack when they are in that particular situation, but usually people tell them that's normal for them, and they are untreated, and they're treated only when their functionality is severely affected due to these phobias. So the agoraphobia is less common, that is about 1 to 8%, and is present in the young adults. So the young adults are more prone to developing these kind of agoraphobias, being in public, being scrutinized by the public, So the social and specific phobias about 2 to 14%, and it is present in 75% by the early adolescence. So the people developed usually with the passage of time, they develop those specific phobias to heights or to water, depending upon their life experiences. So the life experiences, the environmental factors are again very important whenever we are talking about such phobias. Now, 90% by the age of 23 years. So 23 years is a lot of time, and the person has gone through some personal life experiences that are quite particular to that particular patient that we're talking about. And it can be some incident that took place in the life of that person related to height or related to water that is again going to trigger that panic attack in that particular situation. So the history taking again is very important over here, even when we're talking about them. Females usually are more prone to developing these kind of phobias, and the particular age group that we usually talk about is the adolescent age group, and till 23 years of age. So this is the particular age group that usually goes through and suffer from these kind of phobias. The risk factors, the genetic element, increased risk in the monozygotic twins, and they're more likely to be affected if one of the twins is affected due to a particular phobia. The other twin is to be affected. So this is one of the genetic factors that we have to consider, either both affected or both are not. So genetic element is very important. The relative risk factor is almost 2:3. The social factors, either the individual is divorced or widowed. So one of the risk factors that we usually consider is the divorce rate and the widow and being unemployed. So the normal panic attacks are going to be there in these situations when you have a low income, when you are socially unstable. Then the panic attack or the raised flight and fight phenomena is going to be seen in these individuals who are socially upset in their life. Low educational levels, so it's again a risk factor that has to be considered. Agoraphobias are related to panic disorders. They are unpredictable panic attacks in these situations, and the development, even without the previous panic disorders. Sometimes the people may or may not have a past history to such agoraphobias. A premorbid anxiety is usually what the person will give you a history of. Then the person can be suffering from depression. So this is one of the comorbid state that the person can be suffering from. Then the dependent or avoidant personality traits are seen in these individuals, and the lower perceptions of self-efficacy are again seen in these individuals. 3 times as common in women as in men. So this is the prevalence rate that we have to keep in mind. The social phobias are sometimes with or without shyness, and the premorbid personality is usually seen. The person will give you a history that they have an anxiety attacks, sometimes not an attack particularly, but that raised heart rate or that sweating phenomena of the milder form, of course, was seen even previously, and the symptoms of anxiety or panic attacks are seen, and the degree of anxiety varies in these individuals. They perceive others as potentially negative. So that pessimistic point of view about the others is again very important to keep in mind. The prevalence increases to 12 to 13%, and they're present at a very early age in these individuals. They're linked to the behavioral inhibition as well, and the avoidance and withdrawal to the safety is again very important. Amygdala is the part of the brain that is involved in the development of the social phobias. Increased bilateral activation is one of the causes, and then the more regional cerebral blood flow is another cause that can result in these social phobias. Now, the use of the learning theory is again very important, and after the exposure to the particular stimulus, classical conditioning with the trauma, when the person is exposed again and again with that traumatizing situation, he sometimes get used to that, and there is a reduction in anxiety seen in these individuals. And then there are the evolutionary theories as well. Phobias mainly focused on these particular situations and the kind of the evolutionary adaptation. So sometimes with the passage of time, these symptoms rather persist or they decrease in their severity. That depends upon the individual and his willpower. So in this section, basically, we focused on the phobic disorders. Their prevalence rates and their risk factors are discussed over here. So that is the end to this section. Thank you for watching sqadia.com.